Good morning, teacher. My topic is effect of CTGF on CE146, stem progenitor cells in periodontal ligament. Definition. This is an area of contemporary science based on the principle of cell biology, biomaterials, and biophysics focused on solving the clinical and surgical problems derived from the loss of organ or tissues and their functional defects. Cell which the characteristics of the supposed mesenchymal stem cells have been found in the regeneration of periodontal tissues, which implies their participation in periodontal regeneration.
Knowledge sake, I'm going to tell you. So one of the experiment was that they transacted the root and they placed a metallic barrier. Let's say this is the metallic barrier, and the distal surface of the root, this one, let's say, it erupted because it was attached to the follicle. All right. So it was proven that the follicle is very important in the root eruption. And few other experiments were done on rodents, and those teeth, to be precise, incisors, were designed in such a way that the effect of root growth and vascular supply were nil in them. Okay? So these experiments showed that as long as the perineal tissue is available, the tooth movement occurs. Okay? And third finding is that there are several deformities or say diseases like multiple calcifying hyperplastic little follicle. So in these cases, also what happens is there is delayed permanent graft. So now we have three findings which support that this periodontal ligament or say the dental follicle radial complex is important for tooth eruption. Also, if you give some drugs which they interrupt the proper formation of collagen, then also the tooth eruption will be interfered. So all these experiments they show that as long as the dental follicle or developing head periodontal exists, eruption can actually occur. We also know that our fibroblasts, say these are our fibroblasts, they have contractile properties. So they have the ability to contract and they transmit the contractile force to their extracellular environment. Okay, and particular to the collagen fiber bundles. Also, these are in contact with one another. Hence, they form fibronexus. Okay, they exhibit fibronexus, by which such forces can be transmitted to the collagen fiber bundle. Imagine this. Let's say we have our root here. Let's say we have collagen here, and let's say we have fibroblast here. So a simple analogy that has been given in oral histology is that this fibroblast is our sailor, okay, and it's pulling a rope, this blue rope, and this is the collagen, okay, and this rope is attached to a sail, and that is our tooth. The sail is our tooth, okay. Thus, according to this theory, eruption of teeth could be brought about by combination of events involving a force initiated by this fibroblast, and this force is transmitted to the extracellular compartment via the fibronexus that was created, okay, and to the collagen fiber bundle, which are aligned in a proper or appropriate inclination, and this brings about the teeth. Also notice that these fiber bundles they must have the ability to align themselves in a proper way, because if there is interference in this ability to align, then the eruptive pathway is hampered. The opponents of this theory have questioned the existence of fibronexus. So the existence is kind of questioned, and the junction which appear means these are joined to each other and they form fibronexus. cells would not be able to transmit a tractional force that is required to pull the tooth in eruption. So in summary, eruptive movement is multifactorial, like vascular pressure will be at the apex, along with the contractile force that is generated by the retinal follicle. So these all play an important role, and bone formation and resorption facilitate the process. So I hope this video was helpful. If you like the video, please don't forget to subscribe and press the bell icon and kindly share the video. I also have the part 1 of this video, so kindly go check out that video as well. Thanks for watching. Allah Hafiz.
Application in dentistry. Salvage the characteristics of mesenchymal stem cells have been found in the regeneration of periodontal tissues, which implies their participation in periodontal regeneration, and the properties of stem cells have also been observed in cells derived from other dental tissues, including the pulp of the seed human, and were found to have a high proliferative capacity and express relative vascular markers, such as basic fibroblast, growth factor, and endothelium. These cells are capable of generating robust bone in vivo.
Hi, I'm Dr. Joe Nemeth. I'm a periodontist in Southfield, Michigan, and I want to talk a little bit about a possible future for dentistry, and it's regarding stem cells. There is research being done now at the University of Pennsylvania, Tufts University, and I think other institutions around the United States, possibly around the world, on utilizing stem cells, human stem cells, to build and grow bone or revive actually dead teeth. Now, there are 5 different sources of stem cells in the mouth around teeth. There are stem cells from the ligament, or that's the tissue between the tooth and the bone. There are stem cells in the pulp, or the center of the tooth, where the blood supply and the nerve are. There are stem cells around the follicle, or a baby tooth that's developed before it comes into the mouth. And there are stem cells at the tips of the roots of teeth. So there are a number of sources of stem cells. These institutions are trying to see what they can develop with the stem cells. I think in some cases they're actually implanting them in the bone and actually growing teeth. Well, my ideal would be to take some of these stem cells, maybe from the ligament between the tooth and the bone, and somehow be able to activate them so that we can get new bone and new attachment to the tooth that's losing bone from gum disease. So once we clear up the affected infection, if we can stimulate stem cell growth in that area, which can then stimulate bone growth, it would be a huge, huge advance. And I think someday it may happen. Right now, we don't really have anything that is really practical for doing that, but there's ongoing research. I'm very interested in it. A friend of mine in Florida, Dr. McCauley, is very interested in it. We're going to be doing some more work and research to try to find more about what possibilities there are, and certainly I'm going to keep you updated on it. I know stem cells are an exciting new area of research. People are interested in them, and I just wanted to talk about them a little bit and what is so far starting to happen in dentistry. Please join our YouTube channel, subscribe. We'd love to hear from you. Any comments, questions? Try to keep you abreast of everything that's going on in dentistry, maybe some things that are outside of dentistry. So keep your mouth healthy. You're going to have a healthier body. Have a great day. Restore your smile and your health. Visit drnemeth.com to schedule your appointment today.
Pros and cons. Population of adult bone marrow derived dental pool mesenchymal progenitor cells have the ability to stem cells. Mesenchymal progenitor cells capable of cell fibroblasts, osteoblasts, and cementoblasts are involved for periodontal ligament repair. The complete of and regeneration of complex, the completed and periodontal of complex periodontal structure including cementum, periodontal ligament, and alveolar bone. No cons was found in the investigation. History applied in Ecuador. With prior informed consent endorsed by the Biostic of the Faculty of Higher Students, premolars were avoided in the donation of patients from the orthodontic specialty clinic. Alteration group periodontal held first and second premolar, that bone maxillary and mandibular. Systemic distance patching inhibited and or periodontal disease premolar with the presence of dental calculo and caries. In conclusion, the review and analysis of the present literature supports the possibility of using autologous progenitor cells, the periodontal ligament, as a therapeutic measure to treat the sequelae of periodontitis and periodontal bone defect in humans.
Hello, my name is Lisa. I'm a lecturer of the Department of University of Japan. Here I'm going to introduce my article, Our Journey with Periods, Progress, Challenges, and Potential Applications of Oral Stem Cells. I hope you enjoy it. Oral Stem Cells Progress and Potential Applications of Oral Stem Cells. Oral stem cells include oral epithelial cells and oral mesenchymal stem cells. Cells that activate from oral tissue, and their surrounding post-oral tissue, circulate intestinally. The many oral tissues exist from each and usually disposal and hospitalized. And alone, about 11 teeth are disposed each year. However, teeth and their sorting system are not useless. They are handy because they can stem cells from food, especially the deciduous teeth, are more valuable because they provide higher quality stem cells. Here is a human stem column for stem cells. When you cut the tooth like this, you see that dental cavity like this. From the dental cavity, you take each of the oral mesenchymal stem cells. The tissue attached to the surface of these cells also provides oral stem cells. These oral stem cells are not only a highly regenerative entity, but also widely used in regenerative medicine. Here, I will talk about the current research about oral stem cells. Before we talk about oral stem cells, let's take a look about stem cells and organ formation. In an organism, all the tissues are built from pluripotent and multi-stem cells. The embryonic stem cell is protein stem cell, epithelial, mesenchymal, and other tissue-specific stem cells. Interaction among these cells, tissue, and regulate developmental processes, starting with the formation of highly specialized functional tissues and organs, such as tooth and follicle, mouth, teeth, and other tubular organs. When the organism matures, the pluripotent and multi-stem cells divide and now get protein. Adult stem cells then use one tissue to sustain their strength and nourish. Adult mesenchymal and epithelial stem cells make oral tissue. Here's the diagram of a mature tooth. From dental cavity, stiva, and periodontal ligament, we have 10 mesenchymal stem cells, including hippocampus stem cells, these stem cells from explorative deciduous teeth and stem cells from apical tubercle. Periodontal ligament stem cells, TRABAJO, and vesicular stem cells from Tiva MSCs. From oral mucosal epithelial stem cells have isolated. During the past 2 decades, researchers have found that oral stem cells have potential for the regeneration of various tissues and organs. For example, oral epithelial stem cells have been associated with pericorneal and esophageal epithelial and animal models. Oral mesenchymal stem cells have a lot